describe the ethical values and traits of a nurse in one word or two words, what would you describe them as?
I would guess that the most important ethical value for nurses is caring. I think that's very important in terms of the ultimate goal of healthcare, although we tend to get wrapped up in all of the procedures and rules and regulations that we have to follow. The bottom line of what we all do in healthcare is taking care of each and every patient who we come into contact with. So I think caring is the primary trait that you look for in ethics in a nurse.
If you're willing to share, have you ever been put in a situation or encountered a situation where you or a coworker had to make a decision that may or may not have been agreed with your own personal values?
I work in a surgical area of a hospital, and I definitely think that there are times when there are, for instance, gynecological procedures that have to be done, people who have very strong feelings about right to life and female reproductive values have a hard time with some of the procedures that they're asked to assist with. So I've seen people struggle with that and try to balance out their responsibility to every patient who comes in that door and every physician who you work with your own personal values. And I think that's difficult for people sometimes.
Have you ever been put in a situation where nurses around you are acting unethical? And if so, what would you do in this situation, and what kind of resources does the hospital do?
Well, I worked in the hospital system for since 1986, ever how many years that is, a long time. And I've seen our, not necessarily our ethics, but the rules by which we function change. For instance, HIPAA regulations. We used to be much more free to talk about patients and those sorts of things than we are today. And I know that personally, my husband was going on a golfing trip with a group of men, and the guy who was organizing it got put on my surgery schedule for the day they were supposed to leave. And so my husband called and said, I'm going to have to get really busy because I'm going to have to do the stuff that so-and-so was supposed to do because he's sick. And I said, oh, well, let me know what I can do to help. And the next day he came home and he said, he's having surgery. I said, oh gosh, well, I hope he'll be okay. And the next day he came home and he said, he's having your surgery. He has a stone. Y'all are taking care of him. And I said, oh, really? And he said, you've done this all along, haven't you? But the patient's right to privacy is an important part of what happens when you come to the hospital. And so unless you have that person's permission to discuss it, 30 years ago, nobody would have thought anything about saying, yeah, I know he's got a stone, we're taking care of him. In this day and age, that doesn't happen. You don't share any information about a patient. And if you do, there is a system where, in the hospital, where complaints are registered and they go through the compliance people, and people lose their job over little bitty slips like that. So it's a constant monitoring that you have to do, that just for that one particular area of the ethical part of taking care of patients is keeping their confidence.
I appreciate you sharing your experience.
You're very welcome, and good luck to you with your career.